Hello, hi, good evening, ladies and gentlemen. Welcome to our Dr. Vet dinner again. Okay, I'm Vincent here, and I'll be your main host and translator for today's session. Okay, what an amazing week we had for the past week. And over the past 19 days, we have quite a number of rank advancers already, including a few new directors. Okay, congratulations. And keep up the good work. Okay, it's only half time, so we still have the second half to go. So make full use of the campaign to actually bring contact more customers, contact your prospects, and bring your level business to the next level. All right, and I'm so excited, and I'm pretty sure a lot of you will have a lot of rank advancements. Okay, by the end of the month. Okay, and so keep sharing with your customer prospects and inviting them to today's health talk. Is actually one way to grow your business. So you have sent your prospects and customers just the link earlier. Okay, just send them a reminder again, so that they don't miss out the wonderful session tonight. As for those who wish to listen to the Mandarin session, okay, you can tune in. If you are using computer, you can look for the interpretation button at the bottom of the screen, just like a globe. Okay, and click on that and select Chinese. And of course, if you are using a mobile, you make more and then select Chinese. All right, I will be doing the translation after the introduction. So let's get started tonight. Okay, in fact, I'm not sure whether you are aware, but 1 in 5 Malaysians is actually living with diabetes. Okay, giving Malaysia a title of actually the sweetest nation in Asia. So in fact, half of them were not aware that they actually have this problem, and there's an increase in diabetes in the younger age group. Okay, meaning the younger people are getting the diabetes earlier. All right, and more people are getting, more young people are actually getting, due to the diet and maybe lifestyles. So in fact, diabetes is not just a worldwide, it's not a problem, it's not just a problem in Malaysia, but it's also a problem, big problem here in Asia, including Singapore and China. So today, doctor will be discussing with everyone the different types of diabetes and also the 𝐬𝐮𝐠𝐚𝐫 approach to diabetes. So, and of course, a doctor will also be touching on our very important product, which is the balanced oil that can help to improve our cell health. And of course, when we have a healthy cell, okay, naturally our body will generally be healthy as well. And of course, he's also touching on the very important tool, which is the balance test. Okay, the balance test. This test is actually one of the key drivers as to why 𝐬𝐮𝐠𝐚𝐫 has been growing so rapidly worldwide. All right, so you see, every company out there is, they're saying they have the best product, they have a lot of testimonials. Okay, here is, we have a lot of good testimonials as well. But not only that, we do more than that. We use a test report, okay, to show that the product that they are taking are effective. So the balance test reports will give a very clear indication of the current health status. So as the society gets more educated, the size and the facts of the report will become more important and more relevant, okay, to the general public. And until today, we have done more than 730,000 tests worldwide, and the number is just like growing every single week. And I'm so excited to see the number growing up, coming up every single week, right? So, and one thing about this balance test, okay, whether you're doing the first time or second time or 10th time, 𝐬𝐮𝐠𝐚𝐫 or third party lab with us, okay, will not know who actually sending the samples. So you can be very rest assured that the results generated are always fair and accurate. So by the way, for those who just join us for the first time, welcome, okay, to the session. And 𝐬𝐮𝐠𝐚𝐫 is actually a pest-based nutrition, and also we are also a public listed company based in Sweden. We also we also have the world leading company with the largest fatty acid test database. So 𝐬𝐮𝐠𝐚𝐫 has been serving many satisfied customers in Europe over the past years, and now we are just starting in Asia. All right. So with our balance test and our balance oil, okay, and with Asia markets coming up, okay, I'm very sure that it will be definitely bigger than ever. And of course, before the end of the session, we open up the field for some Q&As. And this is a wonderful opportunity for you to ask Dr. Abraham anything regarding your health and products. All right, I'm pretty sure over the past week you have encountered plenty of queries from your customers, from your prospects. You talk to them and they will asking you this and that about anything about the products. So if you're not sure, okay, this is the best time, okay, for you to ask doctor. Okay, you can type into the chat, prepare your questions earlier, type in the chat box, okay? And then it's the best time for us to share and learn knowledge together. And as you understand more about the products, you will be more confident and you'll be more confident when you are sharing the product to your prospects. All right, so let me give everyone a short introduction of Dr. Abraham. Okay, Doctor is based in KL, okay, Kuala Lumpur, Malaysia, and he has been in the medical field, worked in hospital for more than 40 over years. So even though he's a very experienced doctor and has helped plenty of patients back to their health. Okay, so even though he's a medical doctor, okay, he truly believes in the holistic approach to keeping our body healthy. And right now, he's also in the scientific advisory board for Zinzino and has been working very closely with the rest of the board members, all right, and leadership, okay, to develop more wonderful and better product for you and the market. So without further ado, okay, let us all just type in 888 into the chat box. Okay, and give our warmest applause to welcome Dr. Abraham. Doctor, please.
Thank you, Vincent. Good evening, everyone. Good evening. Today, we are going to focus a little bit on something that looks very common to all of us. You see, over the last 60 years or so, our lifespans, average lifespans have increased. The overall lifespan has not increased much, but more people are living longer. So the average lifespan has gone up in many countries. And if you take Asia, you will find that Japan has got the longest average lifespan. I must congratulate Singapore being number 2, and the difference is not very much, just by a few months. I had thought throughout my life that people living in warm countries will not be able to enjoy long lifespans. But I'm glad to say that I was wrong, because in Singapore, they've been able to achieve that. I think given a little bit more time, they might even beat Japan. Now, this is good news. As we live longer, more of us are now exposed to what is called age-related diseases. Remember, all of us are going to die someday, and there is a process called aging, which nobody can escape. Nobody has escaped so far. Now, as we age differently. Different people age differently, some faster, some slower. And in the same person, different parts of the body age differently. Some people have very good looks on their face. In other words, less wrinkles, very little wrinkles. But they may have other medical problems like heart disease or cancer. So certain parts of the body has aged slower compared to other parts. I'm always reminded of a very elderly lady who went to see a doctor because she had pain in the right knee. She was in her late 70s and started complaining to the doctor that she has never been to hospital. This is the first time. Why is my right knee giving so much trouble? I didn't do anything wrong. I didn't fall down. And it was a little late in the day. I think the doctor was a little tired. He tried to explain some things, but the lady would not listen because she felt very bad that after 70 over years, she has to see a doctor for the pain. So the doctor was very abrupt and said, this is due to old age. Now, the lady quickly said, but doctor, the other knee also has the same age, but I have no pain in that. Why only my right knee? Okay, this is just to show you the aging process varies from person to person and from organ to organ. Some of us do not have diabetes, but develop heart disease. Some people are okay with both, but they have bad arthritis. Some have high blood pressure without the other problems. You see the variation. Now, one such disorder is diabetes. It is increasing everywhere around the world. As Vincent mentioned earlier, Malaysia is one of the biggest culprits. In Asia, Malaysia is now number one when we are looking at the rate of increase in diabetes. Okay, the rate of increase. When I say number one, the figures must be compared with the population. So when we look at the population and incidence ratio, the rate at which people are getting diabetes, Malaysia is number one. It used to be South India. Now we are even overtaking them. Okay. Why does this happen? We get numbers like 1 in 5. Initially, it will look like 1 in 5 is only 20%. But we are talking about adults. So it may be just 1 in 3. In fact, certain countries, they are giving figures as high as 60%. They have included diabetes and pre-diabetes. You see, all diseases do not come suddenly, started day before yesterday. No, it slowly builds up in the body, whether it is blood pressure, high cholesterol, heart disease. It's a slow build-up. It will reach a stage where it begins to give some symptoms. You don't feel good. And then when you go for a checkup, they find out. So it doesn't mean that 1 week prior to that, you were okay. Now, the same thing with diabetes. They describe a condition where if you do the appropriate blood test, you can find out whether you are already coming into the diabetic range. And this is why I usually encourage people, anyone above 40. Some people get diabetes a bit earlier, but as a general rule, above 40, you must check your blood out for a number of things, not just sugar, your cholesterol, your liver function, your kidney function. And these tests are now quite easily available, and you should do that as often as is necessary. You are 40 plus, everything turns out to be normal, maybe once a year is enough. Okay, now we have a situation of this particular disorder. I won't call it a disease, a disorder. Now, what is diabetes? Everyone would be ready to say, it is increase in sugar. Is it really? I want to challenge that belief. There is something going on in the body, and one of the manifestation is the body being unable to handle sugar efficiently. So it is not sugar only. There is some change going on, and we don't know the whole picture, because along with increased sugar comes disorders of the heart. Heart disease is higher in people who have diabetes. Kidney disease is higher in people who have diabetes. Dementia, Alzheimer's, eye problem is more among people with diabetes. When I say eye problem, it is the back of the eye. When you're looking at somebody, what you see of the eye is the front part. You don't see the back half. The back half is an extension of the brain. In other words, it's made of nerves coming out from the brain. And therefore, anything that affects the brain or the circulation or the connective tissues in the brain can affect your eyes. I'm sure some of you have heard diabetic people going for eye treatment with laser. Okay, now that is a complication of diabetes. Now, one can say, okay, yeah, this is what happens because if you don't control your sugar levels, you will land up with all these complications. And that is substantially true. Those who do not control their sugar levels either by diet or, if necessary, medications, they tend to have more complications. But then there is also a subgroup of people who are very careful, and every test will show that they are controlling their diabetes very well. Now we have tests, and in fact, last 20 years, we've been having a test where you can check to see that your sugar levels were out of order over the last 2 to 3 months. So you have two types of tests. One test to show what the sugar level is now, and one to see whether over the last 2 to 3 months, it has been going up and down. And if anybody wants to check their sugar levels, I would strongly recommend that you do both tests so that you know where you stand, okay? We notice that those who have good control of their sugar, not so many as the people who have not that much control, but still they do have complications of diabetes. So it looks like it is just not the sugar alone. The sugar, excess sugar, causes damage, and we will talk about it in a short while. But even when the sugar is under control, there seems to be damage. And then you have a small group of people who, well, they take medication, they are careful, on and off, they don't take medication, their sugars go up and down, and they seem to be quite okay for many years before they get into trouble. So if you look at diabetes overall, it looks like a disease or a process that has started and is going on in the body, and the main action seems to be the aging of your body and your organs. If you have to put it in one line, diabetes is a process which speeds up aging. So we not only have to control the sugar levels, we have to look at other areas too. Now, first of all, why does the sugar go up? Everyone knows that it is insulin. Initially, we thought we don't have enough insulin, and that's why the sugar levels go up. Then years later, they found out some people have high insulin, and yet they have diabetes. They find that production of insulin alone is not enough. As we get older, the quality of insulin we produce may not be that good, doesn't work that well. And even when you have enough insulin, for some reason, the cells which are supposed to allow sugar to get in to produce energy doesn't come through because insulin, which is the gatekeeper, is not working well with the cell. It resists the action of insulin to some extent. And so we call that insulin resistance. Now, giving it a term does not solve the problem or explain what is going on. In fact, we are not sure, okay? It may be poor quality of the cell membrane. As we get older, cell membranes also get older. If we do not take care of our nutrition, cell membranes also degenerate. So they are not working that well. You have extra insulin being produced because of your age. The quality is not that great. Add to that all these problems. Now, there are other matters also related to this. There are certain cells in the body that allows sugar to come in a bit easier. Not all cells are equally strict. If you have a lot of sugar in your blood, many cells will resist it from coming in. But there are cells in the body which cannot do without sugar because they are critical cells, like your brain cells, your kidney cells. They have to filter waste matter very quickly. So these cells allow a greater entry of sugar. So what happens is when you have high sugar levels, more of them rush into the brain cells, kidneys, and also the vessels of the heart. Why this particular area, we are not sure, but it happens. So you get extra sugar coming into the cell. The cell is not able to convert this sugar into energy fast enough. So the sugar gets dumped into the cell. It is like, let me put it this way. You're doing renovation in the house and you need concrete. So concrete is coming in and you are plastering your wall. But then the concrete that is coming in is more than what you need or faster than what you need. When you leave the concrete on the floor for more than a day, it becomes solid. Now it has made the house look worse and less functionable. Okay, the same thing happens in the cells. The sugar gets attached to protein in the cell, and each cell is very complicated. There's a lot of biochemistry going on, and if this happens, it is going to handicap all the biochemistry of the cell. A little bit initially, a bit more after that, and this is going to disrupt the functioning of the cell, which is how aging takes place. So we need to, for a start, keep the sugar under control. Those who are early in the disease, if they are careful with the diet, increase the usage of sugar by increasing your physical activity, you can control it. But that's the time that you are young, you feel energetic, you don't feel that you need to put so much effort into all this. Then it goes to the next stage where you need medication. You need very simple medication to control the sugar. Sugar levels going up do not create much of a symptom in the body. So some people may not be applying themselves well. So after some time, you need stronger medication. You are also growing old. Your body is less efficient. The disease is getting more severe. The disorder is getting more severe. Now, diet and medication alone does not do the full job. Now you have to go to the final level where you have to take insulin injections. Okay, for some people it takes many years to get to insulin level. For some people a bit earlier, and for quite a lot of people they don't have to use insulin till their old age, till their death. They can manage without insulin, just medication. Okay, so these are the steps that happens, and whether you will go through all the steps, we don't know, because it depends on your capacity to be careful with yourself. Now, even with that, there seems to be a difference among different people. Now, I have been in practice only in Malaysia throughout my 45 years plus, and it is one of the best places, I think, in Southeast Asia to observe the different ethnic groups, the kind of illnesses they suffer from, the severity, and so on. Among the three ethnic groups, one group, and I won't mention all that here, is very resistant to diabetes. They don't get it easily. And there is another group, if after 50 or 55, they don't have increased sugar, it'll be very surprising. Most of them get it. And there is another group which is somewhere in between. See, even though the disease is the same, the way it comes to people seems to vary. And the complications it produces. The first group that I said, very low incidence of diabetes, when they do get diabetes, they don't get much complications of diabetes. What I'm trying to say is there is also a genetic influence. Okay, if there is a history of diabetes in the family, you have a tendency to also develop it. Now, many a times it is not a genetic tendency, it is the eating habit. And I've seen certain families, everybody is fat, okay? And then when you ask them to cut down, they say, no, all of us are on the heavy side. It runs in the family, they say. Actually, it runs on the dinner table. Why? Because one child gets to go overseas for studies, and then he comes back after 1 year for a holiday. He's lost all his weight. Now he's in a hostel where food is available only at certain times. He has learned, or rather had to adapt to eating only at fixed times. So sometimes this family thing, it runs in the family. No, you may have to just change the habits. For example, a family starts, the father is a big eater, the children come along, they grow, and they see the father encourages the children to eat well, and so on. So everybody learns how to eat well and gets obese, okay? And even the mother, because the mother has to usually finish off what is left, and she takes it, even if she's not a big eater, she ends up being obese. Okay, I'm not belittling the genetic part. There are families where the incidence of diabetes is higher and subsequent members of the family get it. So what do we do? You look back at your background. Is there a genetic tendency? Look at your dietary habits early in life. If you are the type who have to eat a lot, some children eat a lot. Now, when people eat a lot, that's already an indication that that person's metabolism is not very efficient. They need a lot of food to convert to energy to be at the same level where someone else can eat much less and get the same energy. Now, people like that need to be a little careful. So not only those of you who have relatives or friends who have diabetes, even in your own families, the eating habits must start when you're young, when you're a child. Don't give too much chocolates, don't give ice cream. You encourage the metabolism to slow down because these are refined foods and raise your sugar very quickly. And the body will find it difficult to adjust, to manage it. It will develop mechanisms which will soon bring about a breakdown problem early in life. So late 30s, early 40s, you get diabetes. Now, when your sugar level goes up, I told you about certain organs that are sensitive to sugar. I want to also mention that the lining of the blood vessel is also sensitive to high sugar. So blockages can start occurring in the body. Usually it's the heart and the brain, but for some people, they get gangrene in the foot. Why foot? Why not hands? They find that when you have an inflamed circulatory system, the further the distance from the heart, the more prone you are to get gangrene. Now, the furthest part are your toes, and gangrene usually starts there. I hope nobody reaches that stage. Okay, so what do we do now? As I said, look at your family history, your family eating habits, change it to the best diet that you can early in life. Put this habit into your children. Even if they are teenagers now, they won't listen to you. Tell them. They need to start at this age, okay? And there must be some physical activity, okay? Now, the second thing is, sometimes it comes to a lot of basics. Stress increases your blood sugar. Did you know that? If you are stressful at work, you put out 2 different types of hormones. Both these hormones raise your blood sugar, okay? Which is good. You need that extra energy to overcome the stress, which is what happens when you take part in a sports or you take part in an interview or a debate or something like that. Now, after it's over, the hormone levels come down, and if you're doing some physical activity, you clear the system of the influence of these hormones. In modern lifestyle, we are working in a stressful environment which doesn't go off. The stress is high. When it comes down, it doesn't come to base level. It is still lingering. So these hormones that are supporting how you manage your stress levels remain high, and it pushes up the sugar for longer periods. One hormone is short-acting, the other one is long-acting. And we find that quite a number of diabetics, they wake up in the morning and their sugar is high. We do the test again after a meal, it's normal. Why is it early morning, even before taking food, it's high? Because they are under stress, the sleep pattern is not restful, and they force this long-term hormones for stress forces the liver to produce the sugar. So when they get up in the morning, it's high. Okay. Sometimes people take too much medicine, thinking that medication is not enough. Now that will push the sugar down low after food, and then they overeat. So the whole thing can go out of whack. So stress is a very important part in developing diabetes and also in controlling it. What happens to the sugar? Can the body handle the sugar? Okay, we got high sugar. We need sugar, a little bit high, so what? Now, the body tries to keep the sugar within a certain safe range. When it goes above that, the body tries to use its best. It will bring out the sugar in the urine so that it can throw it out. Okay, so you get sugar in the urine. That was the oldest kind of test that we used to do. Many people think that, oh, you get sugar in the urine first and then the blood. No, you get it in the blood first, and when the body cannot manage it, it pushes it out in the urine. If you have sugar in the urine, you're already more than an established diabetic. Okay. The second step the body takes is to convert the sugar into a storage form, so you can use up what is excessive in the blood. The storage form is what we call a glycogen that can be stored only in your muscles, and it is very limited. The storage is such that if you start using this storage, it can last you about 20 minutes to half an hour. So you can't really store much. Now the body has a third option. It will store it as fat. Fat can be stored for long periods and used again. Yes, excess sugar in your diet or simple carbohydrates can cause increase in body fat. Okay. Now, when that fat level increases to a certain level beyond which the body requires as stored fat or stored energy, then certain hormonal changes start taking place, which will contribute to getting diabetes. So body fat should not be beyond a certain percentage. So when you weigh yourselves nowadays, please check. I mean, these machines are easily available. Check the percentage of body fat, not BMI. BMI is a guideline, but not accurate. Weight, yes, get your weight, get the percentage of body fat, and see that it is within normal limits. Okay, what is normal limits? I would say a working percentage for the male, 25%. Okay. If you want to look really good, maybe 20%. If you want to look ripped with all your six packs and all that, you got to go lower. Okay. For a lady, up to 30% is okay. Don't go for too low a weight. It will affect your hormonal balance negatively. Okay. Okay. So now sugar. Back to diet. Okay. So we looked at genetics, what you have inherited. Look at your dietary habits over a long time. If it is already late, you have diabetes already, please look at it seriously, diet. Okay. The other thing that I want to stress is because the aging process is speeded up, there is a lot of free radical activity in the body. So we need more antioxidants. How do we get them? We have to eat vegetables and fruits. And many diabetics switch to fruits which are sweet. Sweet fruits are nature's dessert and is off limits for diabetic people. Yes, even though this is a natural sugar. Don't take sweet fruits if you're diabetic. Take plain fruits, pear, green apple, maybe papaya, a slice or so. Don't take orange, grapes, mangosteen, durian. Any sweet fruit will contribute to your diabetes. Once in a while, you may indulge in it, and make sure when you take sweet fruits, take it after a meal. Don't take it on an empty stomach. Your sugar can shoot up quite fast. Okay. Now, when it comes to medication, I will let your doctor decide. There are something like 6 different types of medicine. They work in different routes in the body. And that has to be decided only by the doctor who is working with you, examining you, and is able to follow up with you. Okay? Don't neglect that part. Stick to it. When you take medication, you will have problems. Many people, that one causes this problem. I don't want to take anymore. And they stop. No. Go back to your doctor. Tell him, this is causing me this problem. Can we try something else? And there are medications to adjust to your needs. So work with your doctor, okay? Are there any supplements that we can take that can support the body? Yes, you need to take a multivitamin, take some extra vitamin B complex. As your sugar goes up, your vitamin Bs are used up more. And because of your free radical increase, you will need vitamin C, vitamin E, and antioxidants in some other way than sweet fruits. And there is a limit to fruits that you can eat. How much can you eat? Maybe a pear or an apple a day, maybe 2. And after that, it tends to get a little boring. Okay, so take some supplements, basic supplements, and some supplements which can help. The other one is chromium. I would suggest chromium picolinate for anyone who has diabetes. Is there anything more you can take? Yes. Zinzino offers 2 products which can you should add to the supplements to support your body. The first one I would say is 𝐸𝐻𝐳. Now, without going into all the details of the product, it offers an antioxidant value which is probably the highest in the market at the present moment. Our daily requirement is about 3,000 to 7,000 units. The unit is called ORAC, ORAC, ORAC. So your requirement is about 3,000 to 7,000 depending on your personal needs. Per serving of 𝐸𝐻𝐳 provides you 20,000 units. That's a lot. And for a diabetic, that could be a major contribution to well-being. In addition, it has got around 70 over micro minerals and trace elements, which are good for diabetic people. We forget that diabetic people, they are insulin, there is a problem. Insulin is produced by pancreas gland. Pancreas gland also produces digestive juices. So the diabetic people do not produce, you can say, adequate enzyme for good digestion. So they do not absorb minerals as well as they should. They do not absorb vitamins as well as they should. 𝐸𝐻𝐳 has added all this, vitamin A, B, C, D, and E, your daily requirement, not a mega dose, your daily requirement. 70 over trace minerals, micro minerals, and trace elements, and the 20,000 units ORAC units of antioxidant, which is fantastic, this combination. Okay, just one sachet or one serving a day would be helpful. Now, anything else? We offer balance oil, which is basically an omega-3. Now, all of us require omega-3 and 6. We get the 6 in our diet more than we require, but omega-3, all of us are low. You may have listened to a video earlier. We have done about, as Vincent mentioned, 740,000, I think, and we are increasing at the rate of about 14 to 15,000 tests a month. In fact, the laboratory that works with 𝐬𝐮𝐠𝐚𝐞𝐭 has the largest database of fatty acid tests in the world. Okay, now we find that 95 to 97% of those tested do not have enough omega-3 in spite of the fact that they are taking many different brands. Okay, so will your balance oil help with my diabetes, my sugar levels directly? No. Then why do you suggest this? Now, when you look at sugar level, you're looking at insulin, which is a hormone. By the way, insulin is a protein hormone, so it doesn't require any fat to be produced. But the insulin is influenced by stress hormones, which are fatty hormones. Okay, that needs support by omega-3. If you look at the cell wall, cell membrane, if that is unhealthy, you need omega-3 to maintain good health of every cell in the body. For that, you need omega-3 and omega-6. And the actions then going on within the cell requires the right proportion of fatty acids, or what we call in biochemistry, long-chain omega oils. And that is supplied by omega-3 and 6. 6 is enough in the diet because it comes from the cooking oil. 3, we need to top up. There are so many omega-3s in the market. What is so special about yours? 𝐬𝐮𝐠𝐚𝐞 has added a special antioxidant group to the omega-3 to keep it from going rancid, going bad, 1, to help with the absorption, number 2, and also to make sure that the body uses the omega-3. There are 3 steps you have to cross if you want to benefit from any food that you take. You must digest it, you must absorb it, you can still pass it out in the urine, the body must use it. That's a nice claim to make. Can you prove that? Yes. I think we are the first nutrition company to introduce this dry blood spot test, which will show you whether you're benefiting from the product that you are taking. And this is a test that I would urge all of you, even if you're not considering to buy any product, take it. You may be already taking an omega-3. Do the test. You will know whether it's working for you. If it is working for you, well and good, continue with that. If you fall short, you may want to consider 𝐬𝐮𝐠𝐚𝐞 balance oil. And as a bonus, along with the omega-3, we have added adequate amounts of vitamin D3, because D3 is also an oily preparation, goes well with that. We have also added omega-9, which is a monounsaturated fatty acid, which is healthy for the body. Most of it comes from extra virgin olive oil. We put that in so that it supports the antioxidant content of the oil, which further supports the absorption and use of omega-3 by the body. The average requirement of omega-3, there are 2 parts to it. EPA is 1. The other ingredient is DHA. Combined together, the recommendation by different authorities is about 500 milligrams put together up to 1,000. Some authorities recommend 1,000. 𝐬𝐮𝐠𝐚𝐞 has put in 2 servings. The smaller serving itself will supply you 1,229 milligrams. Okay, absorption can vary from person to person, so 𝐸𝐮𝐸 felt that we need to give more than the optimum dose to make sure that you get all the EPA, DHA that you need. So these two products would help you, would support you in not only controlling your diabetes. Please take all the other steps, put all the other steps in place, okay? But also those who don't have any of these problems will develop a better biochemistry in the body to be able to resist these changes, okay? I'm going to stop here, and maybe we can take some questions. I'm sure that you have some queries that you would like to make, either to clarify what I said or any further information possible. Please type on the chat when you have, if you have any question. Thank you. I see that you all appreciate the information, and
ladies and gentlemen, if you have any questions, just type in the chat box and then we can ask Dr. Abraham. Okay, maybe let me get the ball rolling. Okay, we
is
have
diabetes first, yeah. Whether can they take rice, as it will increase the blood sugar? Over the years, I noticed that we are made in such a way that if you don't take rice at least once every 2 or 3 days, we feel very uncomfortable, not satisfied at all. At the same time, rice does increase the blood sugar. So what is the solution? And this is a tip that I'd like to pass on. You see, the old way of cooking rice is boiling it in water, and when the rice is cooked, we filter the water. Today, everybody uses a rice cooker. You don't filter the water. Now, it has been found that if you cook rice in water and you filter the water, that removes about 20% of the carbohydrates in the rice. Now, that's a significant amount. So I would urge all of you, if you want to take rice and you have some sugar problems, cut down on the amount of rice and make sure that the rice is cooked in the old-fashioned way. Now, I don't urge you to boil it and try to filter it with your hands and so on. Now, there are many sieves that are available in the market, metal sieves. You put your rice inside, dip the whole thing in water, cook the rice, and when you take up, it has got less carbohydrates by 20%. They also find that if you put the rice in the fridge, okay, and then take out a little bit every day to eat, the fact that it is cool in the fridge converts some of that carbohydrate into a slightly different form, which takes a longer time to digest. So it can pass through the body with less absorption, what is called resistant starch. So that is another technique that you could use, okay? So cook enough for a week and then put it in your fridge, and every day or every 2 days, take out the little bit of rice that you need to have that satisfying feeling. Now, rice digestion in the stomach increases serotonin in the brain and gives you a very satisfied feeling. Serotonin is quite closely related to melatonin, which puts us to sleep. So don't take too much rice, but take that little bit to support you. Can cancer patient going through chemo take balance oil or elixir? Not can, I would say must. I think yesterday we saw this question. Cancer patients have poor appetite at a time when they require more critical nutrition. So what are we going to do? We have to give it in concentrated form so that absorption is easier and the required amount goes through. Combination of balance oil, 𝐸𝐿𝐼𝐴, start low, because the appetite is also poor. They need to digest slowly. Break it up into maybe 2 or 3 servings, small servings, which add up to 1, okay? It will be good to give both, but please check with your doctor, because they might think you're taking some herbal extract. Okay, reassure them, no, there are no herbs in 𝐸𝐿𝐼𝐴. Parents are having knee and joint pains, can't walk. Can balance oil help? Yes, please give them a higher serving. Now, if they have pain in the knees, it could be early arthritis. Early arthritis, it'll help a lot. But if it is advanced, it may not get very much better, but taking balance oil will at least prevent it from getting even worse, okay? So start giving them. Omega help to reduce cancer. That is a long shot, okay? We need all kinds of nutrition, not just omega-3, okay? 1. Number 2, we are being exposed to a lot of chemicals in the environment, which we are told now could be influencing cancer occurrence. So we need to look at that and reduce the exposure. Thyroid, can balance oil help? If you have high thyroid function, by the way, there are 2, one is low, one is high. For those who have high thyroid function, continue your medication, take balance oil, you probably will respond faster. Does balance oil help people who have low blood pressure? Why do you want to raise your blood pressure? All of us want to reduce our blood pressure. Okay, low blood pressure is not common, but it's you find it in ladies who are very small, tiny, and all that, you see? Okay, now if someone who's looking normal has low blood pressure, better go and check up. You may have low hemoglobin or red blood cell, okay? So will balance oil help? Not with the blood pressure. Someone who's normal in every way but has low pressure would require some exercise to increase the tone of the blood vessels. My friend just had surgery. Can he take 𝐸𝐿𝐼𝐴 or balance oil? Now, if he's already back to taking some food, I will say start both. Again, start with small amounts, let him tolerate it, and build up to the regular daily serving. How much balance oil? Will there be any side effects? Okay. How much do you take? We recommend that below 80 kilos, take about 1.5 teaspoon, 7.5 ml. Above that, you can go up to 12 ml. Now, can you take more? Yes, if you have not taken balance oil before, for the first 3 months, you can take a little bit more because you may be topping up your deficit, okay? After that, you don't need to. Now, in some people, excessive, and I mean 2 or 3 times what is recommended, can reduce your immune system activity. So no need, we don't have to go so high. Friend's husband, cancer patient, his doctor said he can't take fruits and vegetables. Can he take 𝐸𝐿𝐼𝐴 and balance oil? I'm sure there must have been a good reason why the doctor said no fruits and vegetables. I don't know, but you need the nutrition from that. And a good substitute will be balance oil, sorry, 𝐸𝐿𝐼𝐴, okay? What you are supposed to get in the fruits and vegetables. Now, if he has a problem with that, obviously he will be already very low on omega-3 and he would require balance oil. Can balance oil reduce LDL in the cholesterol? Cholesterol is a panel of 4, now sometimes 5 different items in the test. Now, where it seems to work and effect is on the triglycerides. That is usually the second one, okay? And not so much in LDL. For LDL, you need to look at the fried food and the oil that you're consuming in your diet. You need to cut that down, okay? How much balance oil needed to improve a diabetic patient who's having injection of insulin daily? As I mentioned earlier, balance oil is not going to affect your diabetes directly. Because of diabetes, certain changes are occurring, which is an increase in the aging process. That can be slowed down a little bit with balance oil. Diabetes per se, no. Can doctor repeat his topic as I miss up? Okay. Maybe Vincent
yeah, not to worry. We will have the we always record, and then we will have a copy of that. Yeah,
okay.
we can send that to you. Okay. All right.
Don't worry.
Yes. Okay. All right. Okay. Thank you, Doctor, for your sharing once again. You know, we always have a lot of questions, and Q&A is always a fun time. You know, everybody really learn so much from your Q&A. Thank you, Doctor, for your sharing, and I'm very sure everybody has benefited from a fitness advice today. Okay, let us give Dr. Abraham a round of applause. Thank you so much, and I'm looking forward to have this Valencia with all our partners. Okay, sharing the Valencia with all our partners and friends. So for those who are not sure what Valencia is, this is Valencia. You have vitamins, minerals, antioxidant, enzymes over here, and every day we just take 1 or 2 sachets a day. Okay, you may even take up to 3 if you want. Okay, if you're feeling stressed, you know, a lot of free radicals. Okay, you can even take more. But then one is sufficient. Okay, so and this product is available only in Singapore, Malaysia, and Taiwan. All right, and Valencia contains a lot of antioxidants, vitamins, minerals, enzymes, and of course the balance oil. Okay, this is the balance oil. Okay, keep ourselves healthy and keep our body in balance. All right, and this also, the balance oil also make the body absorb nutrition much better. Okay, and also improve the efficiency of taking the products. So if you like what Doctor has said earlier, okay, and have not started taking the product, talk to the person who invites you to the call. All right, and then before you start, we strongly recommend you to do a balance test first. Okay, you may have taken a lot of products before, but you'll try the test. Okay, so that you know where your health status is. All right, and then after you have taken the test, okay, take the product, take the balance oil, take the Valencia for 120 days daily, and then after that, do the second test again. All right, from the 730,000 tests worldwide, okay, tests that we have gotten so far, we can be very confident say that you will definitely see an improvement after 4 months of taking the products. All right, and very likely you will also be in balance or close to it. And of course, if you like the product yourself, okay, share them with your families and friends. And when you have 4 customers yourself, okay, Zeno will reward you with a free product for your sharing effort. Okay, so inviting your friends, the customers and prospects to attend the session is very important, like what we have done today. All right, so this is the upcoming session of Dr. Abraham. Okay, we always invite the professionals like Dr. Abraham or nutritionists to conduct session. Okay, they can explain the product better. Okay, and this help your customers understand the benefits, why they should be taking the balance oil daily. All right, and of course on next Monday, we also have our nutritionist coming in to do a talk on the. And next week he will be sharing on how to choose and eat buffet. I'm very sure most of you has been craving for buffets over especially after a long lockdown. And can't wait to catch up with the friends over a good meal. So Victor, next Monday, he will give you his perspective and advice in Mandarin. Okay, next Monday is actually a Mandarin session. So yeah, remember to send out your invitation and join us on next Monday. And of course, every Wednesday we also have this Thai session. Okay, so if you have any customers prospect in Thailand, okay, wanting to know, only understand Thailand, okay, come to our Wednesday call. Okay, 7:45 p.m. okay, Thai time or 8:45 Malaysia Singapore time. Okay, invite them to the call. Very good chance for you to expand your expand your business or customers into Thailand. Okay, all these links can be found on our Facebook Teams in Zeno Asia. Okay, 24 to 48 hours before the session. If you are not sure or you have not join the group, okay, you can go to our go to our Facebook and look for Team 𝐸𝐻𝐻𝐸 Asia. Okay, we put up here a big one, the Team 𝐸𝐻𝐻𝐸 Asia, this one. Okay, go and join the group. Okay, but before you can you have any access to the group, okay, you need to fill out your name and your ID before our admin moderator give you the approval to access. Okay, stay connected with the company at various social media channels as well. We put out a lot of information, very educational information, product information, training information, and of course our Zoom link at our Facebook group. Okay, and of course, lastly, don't forget all our partners. Okay, don't forget we have some fantastic campaign ongoing. Okay, especially the 200% ECB campaign and also the UPKW reward campaign. These are promotions that will actually drive your business up to the next level. So let us keep sharing the wonderful products, Balance Oil and Malaysia, with your friends and prospects. All right, the webinar is coming to an end today. I'm so happy to be able to see everyone, okay, tonight, and yes, really very excited about it. Stay safe, stay healthy in the meantime, and do plenty of Zoom meeting with your prospects, with your friends, and I hope to see everyone again on next Monday. All right, thank you everyone for your participation. Good night and have a wonderful weekend. Bye for now.